One of the guests, Dr. P.K. Das, has joined, sir.
Start करंतु.
So I welcome everybody. I am from Bengaluru. On occasion of this Baisakhi Utsav and 120th webinar, we have taken this time to organize in collaboration with State and Center All India Senior Citizen Confederation and State Federation. I welcome all the new participants. Today's topic is very much important especially for the senior citizen. Last time we had discussed regarding several aspects of senior citizen and how taking care of senior citizens. So today we are going to start from our topic, heart attack. Heart attack creates fears in everybody's mind. When it starts, either it gives warning or the life ends by few minutes. So Professor Kishore Mishra, the HOD of Cardiology, Sri Ramchandra Bhanja Medical College, Cuttack, Odisha, has kindly joined with us and spared his valuable time to inspire us and the senior citizen of different states. Today, the event presider is Shrihari Shridhaye, Secretary General of All India Senior Citizen Confederation. Now he's on the flight. There is a late of arrival of his flight. He will join when he will be make it convenient. Now our guest is Dr. P.K. Das. He's the President of Federation of Senior Citizen Association of Odisha. And Professor Annapurna Devi Pandey, he's from California. And our observer will be Vivek Patnaik, IS retired. And Mrs. Manorama Choudhury from Bostan, USA. He has joined. He's a good writer in literature. Now we'll start the meeting. Now from the beginning, I will request to give introduction by Kishore Samantray. He's from Senior Citizen Associations and Federation of Senior Citizen of Odisha. I will request Mr. Samantray, please give an introduction.
Good evening to all. I am Kishore Samantray, General Secretary, Federation of Senior Citizens Association of Odisha. Honorable President, esteemed guests, other dignitaries and participants from all over the world. It is an honor on our part to welcome you all to the webinar. Topic heart attack, hosted by the Thinkers Club of Twin City, Bhubaneswar and Cuttack, Odisha. We are also delighted to have the involvement of our senior citizen organizations at both state and national level. The national level organization, the All India Senior Citizen Confederation, Mumbai, is the largest senior citizen organization in India. And the Thinkers Club has invited our Secretary General, Mr. Shrihari Shridhaye, to preside over the meeting. Unfortunately, he is on the joining, and he will participate in the later on. Other dignitaries from AISCCON have also joined. The Thinkers Club have also invited other states, their office bearers and their members to participate in the webinar. Might be some of our friends have joined in this program. We are also privileged to have with us as one of the eminent guests of honor on this event. He is Dr. Prasanna Kumara Das. He is also president of the Senior Citizen Federation of Senior Citizen Association of Odisha, along with another guest, Professor Annapurna Pandey. He is also a renowned social worker, social activist, and she also, good news, he belongs to Odisha, coming over India several times since she is involved with many NGOs. And this Thinkers Club, they have already organized 101 seminars during a period of 3 years. They are mainly dealing with the issues of social concerns and many different aspects of human life. It's a wonderful initiative of Barada Prasanna Das, who is the founder and the president of Thinkers Club. He has successfully involved and engaged the eminent personalities, the intellectuals, the social activists and professionals throughout the world who contribute their valuable inputs and insights to the discussions. Friends, this is the digital world, and social sites are playing very vital role. These are not confined to four walls of a room. Sitting comfortably at our homes, we can have the scope to participate in this webinar. We can also share our views and make opinions. We are reacting to various incidents happening around us. It's a good platform where we can share our views. We can also make opinions. The social sites are the powerful instrument of making opinion of the world and people. And friends, the organizers has not confined this only to discussions. They are also making all out efforts to publish it in print media, the electronic media, and at the same time various social sites. So let us, for a good reason, I invite my friends, let us all be active in social sites, and let us involved in this webinar, personal webinar, for a good reason. And friends, at last, I thank to the Thinkers Club for their wonderful initiative. I also wish them all success in their future endeavors and initiatives. With this environment, I would say that Mr. Vivek Patnaik is also even at the age of 82, he is involved in social activities and social sites. And I would say his participation will work as a value addition to this forum. And lastly, I am thankful to the organizer, Thinkers Club, involving our Senior Citizens Federation and its members in this webinar. Then I thank you all esteemed participants for their presence and participation. Thank you all.
Thank you, Mr. Samantra. You have taken much more initiative to make it grand success. Now, those who cannot join or who cannot listen, they can watch the YouTube after the program when they are free. Now, I will request our Professor Sura Mishra from HOD Cardiology Department, SCB Medical, to please speak over the topic, and at last we may clear the doubts if anybody asks any questions at the last. Welcome, sir. Professor Mishra, please talk to the point.
My screen is visible.
Yes, sir.
Respected Barada, the founder president of Thinkers Club, my esteemed co-participants this webinar, namaskar. Good evening. I am assigned to speak on a topic that is heart attack, which sometimes invokes fear in many. But it is our responsibility to know something about this health problem. Many aspects of this are preventable. And let us discuss something about this common problem. I'm not speaking to only persons who are seniors. This is a problem is no more limited to only the aged or the seniors. It is now affecting the different strata of the society who are young and old alike. Maybe so many factors are responsible for this. You might have come across in the social media about these personalities who have either suffered or survived a heart attack. The names are so many. Just to name a few of them, I'm showing their pictures. You all know this, no need to name them. So what is a heart attack after all? A heart attack, or in the technical term, it's called myocardial infarction. It is a medical emergency. When a heart attack happens, blood flow to a part of the heart stops or is far below normal because of blockage of arteries, which causes injury or eventually death of that part of your heart muscle. So when a part of your heart can't pump because of it's dying from lack of blood supply, it can disrupt the pumping function of your heart. So this can reduce or stop blood flow to the rest of your body, because heart is the pumping organ. It supplies all over the whole body and all the organs, and which can be deadly if someone does not correct it quickly. So how common is heart attack? Let us come to know about the magnitude of this problem. In India, out of every 4 deaths, 1 is due to heart disease. That is around 26%. So this is the estimated annual death in India due to non-communicable disease. Non-communicable means which does not get transmitted from one person to other. That's called non-communicable disease, like cardiovascular disease, diabetes, hypertension, cancer. So out of this, nearly 1 in 25%, 26% is because of heart disease. And out of total heart disease, you can see this figure, nearly 50% is because of heart attack. Out of all types of heart disease, nearly 50% of deaths in India is because of heart attack only. So this figure shows the incidence in various parts of the world. China and India are leading. So, so nearly 50% of deaths because of cardiovascular disease is because of heart attack only. So what are the common factors? Like age, men age 45 or older and women age 55 or older are more likely to have a heart attack than are younger men and women. But speaking about age, now the younger population are also catching up. As going through the data of our hospitals last 1 year, around 10 to 12% of the total heart attacks were represented by persons below 40 years of age. And then that's an astounding figure. Other factor is the tobacco use, which is commonly causing heart-related ailments, and besides other system involvement and heart attack, especially in younger population. And this includes smoking and long-term exposure to second-hand smoke. That is, even if you are not the an important risk factor for getting heart attack besides other ailments. Then high blood pressure. Over time, high pressure can damage arteries that lead to the high blood pressure, heart attack. And that occurs with other conditions such as obesity, high cholesterol or diabetes. All this cumulatively increases the risk even more. Then high cholesterol, and to some extent, another thing is high triglyceride also, which is rather little controversial. But then high level of low density lipoprotein, that is called a bad cholesterol, is most likely to cause narrowing of the arteries by deposition of fatty material in the arteries, which clogs the flow to the heart and even to the other organs. A high level of certain blood fats called triglycerides also increases the heart attack risk. Now, obesity is another important factor, and we Indians are also catching up with the Westerners so far as obesity is concerned. And obesity is linked to high blood pressure, diabetes, high levels of triglycerides and bad cholesterol, and low levels of good cholesterol. So obesity is an important factor which is coming up, and this is contributing to risk of heart attack. Now, diabetes. India is called the diabetes capital of the world. So incidence is in the adult population is more than 10%, 10-12% of the adult population is diabetic in India. So the blood sugar rises when the body doesn't make a hormone called insulin or can't use it correctly. So high blood sugar increases the risk of heart attack. Now, another thing is called metabolic syndrome. I'm not going to the details of it, but the different parts of it is the combination of at least 3 of the following, that is enlarged waist or central obesity, high blood pressure, low good cholesterol, that is HDL, high triglycerides, and high blood sugar or diabetes. Having metabolic syndrome makes you twice as likely to develop heart disease than if you don't have it. So if you are obese, then be aware. So family history of heart attack. So if somebody in the family is the first degree relative, that is siblings and parents, they are called first degree relatives. So if there is history of early heart attack, that is in males before the age of 55 years or females before the 65 years, but in India, it is 10 years less. So in India, if somebody in the family that is first degree relative, that is siblings, means brothers and sisters or parents, have had a heart attack before the age of 55, and females before the age of 45, males before 45 and females before 55, then the person is at increased risk of heart attack. So not doing exercise is a risk factor. If you're not exercising, you are at risk of developing heart-related ailments, especially heart attack. So a lack of physical activity, somebody who is sedentary, is linked to a higher risk of heart attack, and regular exercise improves heart health. So an unhealthy diet, a diet which is high in sugar, so extra calories that is gets deposited as fats in our body, animal fats, especially red meats, processed foods, trans fats and salt increases. So now these days, all the bottles, the processed foods, they have the label on it showing the amount of trans fats and other things. So and salt also, they are high in salt quantity, which increases the risk of hypertension. And all this add on to the risk of heart attacks. So eat plenty of fruits, vegetables, fiber, and healthy oils. And stress, emotional stress such as extreme anger may increase the risk of heart attack. Illegal drug use, cocaine, amphetamines, and other stimulants one should be aware of. That can trigger a coronary event. Even if there is no actual blockage, they can cause a heart attack without actual blockage of the arteries. And in women, history of preeclampsia, that like swelling of body, hypertension during pregnancy, those also increase the risk of lifetime risk of heart attack later on. Then others rare conditions like autoimmune conditions, like you must have heard the name of rheumatoid arthritis, lupus, they also increase the risk of heart attack to some extent. So we have, as we discussed, there are certain factors which contribute to heart attack, which are not in our hands, and that is genetically determined, which are uncontrollable, like a family history, that is not in our hands. Medical conditions like diabetes, sometimes genetic factors contribute a lot. And your individual ethnic heritage, gender, males more and females after menopause, and increasing age, that increases the risk of heart attack. That is not in our hands. So which is controllable, that is which we can modify the risk factors, like we can have an eye on our diet, we can control our blood cholesterol, we can check our blood pressure regularly and take medications and other measures to control the blood pressure. In the last week only, there was an article in Times of India which showed men between before 55, between 40 to 55 years age, nearly 1/3 of them, that's a huge number, have never measured their blood pressure. That's astounding. So we are not even aware that somebody is hypertensive. So one should measure the blood pressure regularly and treat the condition with proper advice from the physicians. Then physical inactivity is dangerous, as I have already mentioned. Control your weight. Stress management is important. Alcohol consumption should be avoided or limited, and no tobacco use or even exposure to tobacco-related materials. So how do you know that somebody is about to get a heart attack, or what are the impending warning signs? So as I have shown in these figures, pain or discomfort in chest, lightheadedness, nausea, vomiting, some are called heart attack sign equivalents. The pain may not be, the contrary to popular belief, it is not about the heart area or the left side of chest, mostly retrosternal, and can radiate to the jaw, neck, or back. Discomfort or pain in the arms and shoulders. There can occur shortness of breath. These are all either direct signs of heart attack or heart attack signs simulating heart attack. So these figures you can see the sites of chest pain. Mostly it is retrosternal, behind our sternum or mid chest, and it can radiate our neck, jaw. But the pain of the heart attack does not go beyond our malar bones, the cheek bones, or below the umbilicus. So within this area, one can have pain of heart attack. So if there are any suspicion, you should go for the next step, consult your doctor, or go take the patient to the hospital, because time is very important and valuable. So there are certain differences in presenting symptoms between men and women. The females are more likely to have chest pain. They complain of discomfort, are less likely to have chest pain. They complain of discomfort that feels like indigestion. They are more likely to have shortness of breath, fatigue, or insomnia that started before the heart attack. They also have nausea and vomiting or pain in the back, shoulders, neck, arms, and abdomen. So certain atypical symptoms in women, one should be careful to note. And what are the complications of heart attack? Why heart attack is dangerous? Nearly 20% of deaths, they occur before the person reaches the hospital. That is because of arrhythmia, means abnormal heart rhythms. The electrical activity is deranged. That is irrespective of the largeness of the heart attack, or the small heart attack or a large heart attack. The electrical disturbance can cause death instantaneously, and many deaths occur before the person reaches the hospital. But other complications like heart valve problems, heart failure, stroke, sudden cardiac arrest, and the patient goes into shock, and subsequently following a heart attack, that can occur depression, anxiety, and mechanical complications of heart attack such as rupture of the valves, other things. So the different complications of heart attack are better prevented than treated. So is heart attack and cardiac arrest the same? We usually sometimes use he had a cardiac arrest or heart attack. So cardiac arrest usually means electrical problem. So it occurs when the heart stops beating suddenly and unexpectedly. The person has collapsed, is unresponsive, has no pulse, and makes gasping sounds, or is not breathing. Without intervention, brain cells can start to die within minutes. So that's called cardiac arrest. It may not be necessarily because of a heart attack. But heart attack is like a plumbing problem. There is blockage. It occurs when blood flow to a part of the heart gets blocked. The person is usually conscious, has a pulse and is short of breath and their heart is still beating, if blood flow is not restored quickly, that part of the heart begins to die. So these are the symptoms I have already discussed. And how do I know that somebody has a heart attack? If you have heart attack symptoms, then you should undergo physical examination. Healthcare providers usually diagnose heart attack in an emergency room setting. They check your pulse, oxygen levels, and listen to your heart and lung sounds. They'll ask you about the symptoms that you experience. They might also ask you about who was with you to describe what has happened. So, in case of any doubt, it is better to take to the person to the hospital or the physician, where at least the diagnosis can be made and the appropriate treatment can be made. Because time is very valuable. I will come to that later on. What tests should you do to determine somebody has got a heart attack or not? Besides symptoms and signs, electrocardiogram or ECG is very important. One of the first tests you get when you come to the emergency room, when heart attack symptoms are there, your heart electrical signals can help you tell if an injury is occurring, as well as if there are any rhythm abnormalities. And blood tests, like you must have heard the name of cardiac troponin enzymes, they start to rise when part of the heart muscle starts to get less blood supply or dies. So the enzymes get elevated, you can get signs. Then ultrasound examination of the heart is called echocardiogram. The part which is damaged or getting less blood supply, it shows in the ultrasound. Then one can diagnose the exact site of blockage by a coronary angiogram or heart catheterization. The other modes like computed tomography, CT, coronary angiogram, MRI, they are also useful in diagnosing the extent of the problem. Exercise stress test can detect the whether a part of the heart is getting less blood supply. Other nuclear scans are there. I'm not going into details of that. But if somebody has had a heart attack, what to do? Restoring blood, our aim is to restore blood flow to the affected heart muscle as soon as possible, because time is muscle. The more time is elapsed, the greater the risk of that part of the muscle getting damaged. And you know what will happen if the heart muscle is damaged. Even if the person survives, he'll survive with morbidity and disability. The heart will fail eventually. So timely intervention is very important. So what they can variety of ways ranging from medication to surgery can be done. The important drugs like aspirin and blood thinning medications you must have had. Supplementary oxygen if the saturation is less than 90%. And clot busting medications, like they are called thrombolytic agents. They provide use these only within the first few hours. Most important, they can be used in the first 12 hours after a heart attack. But if there is facility for coronary angiogram, directly the blockage can be relieved. That is called angioplasty. But if the facility is not there, this clot busting medication should definitely be used. Apart from the blood thinning medications like aspirin and other medicines. Then anti-arrhythmia medications that needs to be decided in the hospital, in the emergency room. If the statins, the cholesterol lowering agents, and the other medications that like blood pressure medicines, diabetes medicines, and they need to be used depending on the condition. And nitroglycerin to relieve the pain. So the most important is time. Time is muscle. If you do not intervene in the timely manner, the more the heart muscle is damaged, the greater is the risk of death or disability later on. So the first medical contact should be done within 10 minutes after reaching the hospital, or even there are many centers where they do it in the ambulance. The paramedics are trained for that. If there is, as I mentioned, if there is facility for doing angioplasty, if it can be done within less than two hours time, that should be done. Or if facility is not available, the clot busting medications have to be administered. Subsequently, the patient can be transferred to a center where angiogram and angioplasty can be done. So most important thing to remember is you must intervene in a timely fashion. The sooner you take the patient to a medical facility, the chances of survival and surviving with less disability is greater. So there are these are technical things. Many this called angioplasty. That we can directly treat the blockage. And these things I'm not going to the details, but you must these days everybody is aware of these things. We put the wire and do a ballooning, put stents, and open up the artery, and the blood supply is restored. And if it is done quickly, almost there is hardly any disability later on. I have shown you few celebrities who have survived and without any disability. I'm not going to name them, but timely intervention had saved their life and their professional career as well. So some persons later on may require coronary bypass grafting. Those who are not suitable for angioplasty, later on they can be sent for relief of the blockade, and they are done under direct vision with opening the chest, and the arteries are bypassed. The blockade part of the artery is bypassed to a healthy site, and blood supply is restored to the heart. What the complication side effects of treatment? One should remember, if somebody is on medications for heart attack or heart-related ailments, there can occur nausea, vomiting sensation, weakness, lightheadedness. Bleeding can occur because with blood thinning medications, one should be aware of. The health providers or who are attending the patient, there can occur infection, damage to a blood vessel following different interventions. And arrhythmia, sometimes somebody suppose is pulseless or sometimes suddenly becomes breathless. One should draw the attention of the medical care provider. Later on, because of treatment, there can be kidney issues because associated hypertension and diabetes. Patient can develop a stroke. All these complications one should be aware of when, as an attendant, you are attending a heart attack patient or you are a patient yourself. So can a heart attack be prevented? That is the most important issue. How to prevent these complications to occur. In general, there are many things that you can do that may prevent a heart attack. Like there are some factors which cannot change, I have already mentioned, but still reducing your risk can postpone when you have a heart attack and reduce the severity if you have already one. So all these things I have already mentioned: stop smoking, choosing the good nutrition, right nutrition, must be physically active, at least 30 minutes per day and 5 days in a week, and check your blood pressure, control it with proper medication and lifestyle modifications, and make sure that you just get enough sleep. 6 to 8 hours sleep is a minimum. The quality of sleep is also important. So this is emerging as a big risk factor for not only heart attack, for many other related ailments also, and other systems also. So getting good quality sleep, and that is very important, especially in this busy life. So avoiding or limiting alcohol consumption is important, and reduce your stress level. Yoga, pranayam, other things that everybody is aware of but hardly do practice. Manage your diabetes. Check regularly. We have got now so many drugs. We can control our diabetes. People are living up to the 90s, even with diabetes. So if somebody has this diabetic or hypertension, need not lose heart. We have got so many measures by which we can control this disease, which lead or contribute to getting a heart attack. So managing diabetes, hypertension are very important, and aiming for the healthy weight. Must be aware about your weight level. Not only you control your weight, and you should guide the others in your family to set the belly fat and have a trim look and control your weight and obesity. So how can I lower my risk? This is a continuation of that. Schedule a checkup at least once a year for checking a wellness or a checkup or wellness visit. Whether you are young or old, must be aware of your body conditions. Like as I mentioned, nearly 1/3 of our population, adult population, they never even check their blood pressure within 40 to 55 years of age. That's dangerous. And same repetition, even if it is repetition, I'm stressing upon it. Quitting tobacco and tobacco products is very important. This includes smokeless tobacco and all vaping products. Exercise regularly 30 minutes at least, and moderate intensity physical activity, and at least 5 days a week. But again, doing exercise extreme exercise is also very dangerous. You must have heard persons having heart attack in gyms, like Raju Srivastava name crops up in the mind, and many other celebrities also have made the same fate, even doing extreme exercise in the gym. So you should do exercise which should be limited by the level of tolerance that your body allows. So one should not be too much enthusiastic. We know in metros, people do exercise in the very early morning or late night because that's the only time they get, but that's dangerous. So eating nutritious foods that includes green vegetables, fruits, and just use common sense. You can't always measure and what you are eating, but using common sense is very important. Everything is available these days in internet. You know what to use and what not to use. Maintaining a weight that's healthy for you, and managing your existing health conditions. If you have a high cholesterol level, manage it. High blood pressure and diabetes, treat it, manage it. And reduce your stress level as far as practicable. Consider techniques such as yoga, deep breathing exercises, and meditation. And last but not least, take your medications if they have been prescribed for your health condition. And keep records of all your medical appointments. And that's important. This figure, again, intentionally I have repeated to harp on you that nobody is free of diseases at any point of life. Somebody, either young or old, gets health conditions, health issues almost regularly, but preventing it and managing it is not beyond reach of everybody these days. Almost everybody has access to quality health care facilities these days, and you should be aware of your health conditions. So what can I expect if I have a heart attack? The treatment you receive for a heart attack does not end when you leave the hospital. That's also an important issue. Your risk of a second heart attack means you will need to take prescribed medicines and make changes to your daily life. What you have done previously should avoid that. When can I resume my usual activities? And usual easy questions. Recovery from a heart attack after leaving the hospital depends on the severity of the heart attack, how soon treatment began, what treatments you have had, and the health conditions you had, if any, before your heart attack. So in general, most people can return to work or resume their usual activities anywhere between 2 weeks to 3 months after their heart attack if the other conditions are stable. And cardiac rehabilitation can help people gradually and safely increase their physical activity back to its prior level. So the outlook for a heart attack today, many people survive a heart attack because of the treatment level that we have achieved. But the outlook is worse for people who are over 65, have heart failure, have diabetes, already had a heart attack earlier. So they may be at risk of another heart attack or of dying in the next, because in this case, providers will work to aggressively manage their risk, not to get depressed over all these things, but you have to be aware, more careful in these conditions. So premenopausal female who are under age of 45 have a better outcome than male of a similar age, but after menopause, the female fare worse than the male. This, I do not want to make somebody pessimistic about it, but you have to accept the conditions and strive to better your health condition. So all these medications, I'm not going into the intricate details. You should take these medications according to your physician's advice, and see your healthcare provider regularly before any serious condition, or if you had other health issues. When you should go to the emergency room, if you have some heart attack symptoms and think you are having a heart attack, you should take an aspirin and other medicine as prescribed. Minutes matter, and when you are having a heart attack. What questions should I ask my doctor? What activities are safe for me to do after a heart attack? I'm intentionally mentioning this because you should be aware of your needs. What are the most important things I should do to prevent another heart attack? How often do I need follow-up appointments with you? Should others in my family get heart attack or heart checkup? All these issues, you should have a clarity of thought in your mind. Thank you. Prevention is always tons and tons better than cure. Thank you. Thank you for your listening.
Thank you, Professor Mishra. But in a very short time, you have apprised many things. You have created consciousness among the senior citizenship. Now, we are very much thankful that you have given your valuable time to apprise the different point of heart attack, which generally creates fear in the mind of the public. So now we'll go to our guests. We'll listen their views. First of all, our State President Federation, Professor Dr. Prasanna Kumar Das is present. So I request Dr. Das, please give your views. Dr. P.K. Das, the President of Federation of Senior Citizens of Odisha. Are you listening me, Dr. Das?
His microphone is mute.
Oh, sorry. Dr. P.K. Das is there, please. I'll request to Dr. P.K. Das is the President of Federation of Senior Citizen of Odisha.
His microphone is muted. You see.
Of
can't
Dr.
listen
P.K.
to that.
Das. Dr. P.K. Das microphone is muted.
Yes.
Oh, he's unable to listen. Then we'll ask the Professor Annapurna Pandey.
He can listen, but he can't. His talk we cannot listen. We can't listen to him.
We'll listen after let others guest speaks. Then we'll listen. Dr. P.K. Das. Mrs.
Namaskar.
Annapurna, please.
Yes, namaskar. Thank you, Barada Babu, the co-founder of Thinkers Club, and all the members of Thinkers Club. Such an amazing service that you are providing, both nationally and internationally, on these pertinent issues affecting everybody. And I must say that thank you again for the presenters and also for the participants. Professor Surakumar Mishra's very, very lucid and educated presentation on heart attack is really, I would say, educational and eye-opening for all of us. So I am as a cultural anthropologist. I do not have much idea about the medical condition, and so it's been very educational. But only I can say from my first experience, very recently, just last month, my husband had a heart attack. And it was so scary because all the conditions that Professor Mishra just mentioned, like, that the preconditions or the cause, like, maybe tobacco or diabetes and food habits, the fatty food, so on and so forth. All these did not apply to the kind of, to this case, but still, I'm sure one thing that I wanted to bring up, maybe I would like to know more about the genetic. What's the kind of, many of us may be taking it for granted that, oh, my lifestyle is so simple that is not going to happen to me. What about those? Like, I was thinking, what could be the other factors that may be something which may be exceptional or which may not be so obvious. And also that I was just wondering that it just kind of, I found out that the 50% of the people in India go through heart attack even before the age 55. If you think that it is an old person's disease or old people's case, Professor Mishra had already mentioned all the celebrities. But again, we just need to be aware that it happens even to young people. I was talking to a friend just last week. She is not even 60. She said, "Oh, Nani, I just had a little bit of discomfort. She's not a smoker. She's not a smoker, or she's not she's not into the kind of habits we discussed. But she said that, oh, I just had a little bit of chest pain, and my left hand felt numb. And since I worked in the medical industry, I took myself to the ER. Here it is the emergency, and she got a stent put." So, like, I was just thinking that even many cases, especially women, many cases we just take it for granted that no, these symptoms are not, that may not be the kind of, heart attack symptoms. So what could we do about that? That even though, like, many of us educated, we read all kinds of literature, brochures, and educate ourselves, but still, when it happens to us or to our near and dear ones, we may be completely oblivious, and we may just take it for granted. So this kind of, any symptom that it could be heart related, like, maybe heart palpitation or maybe restlessness, which we think, oh, it could be a stress. But these symptoms, how do we track it down? How do we really make sure that we see the doctor? So that's kind of, one point I wanted to bring from Professor Mishra's wonderful presentation. And another thing I just wanted to say, that even again, it's educational for me, that the Indian Asian population living abroad, that they they account for a fifth of all the global death for coronary heart attack or heart disease. So I thought, oh my goodness, just kind of imagine. I hear that South Asians are more prone to heart attack. I would love to hear a little bit from Professor Mishra because of the condition. So I would love to know a little more that how this kind of, that South Asians are more prone, and how we can be more aware. That's a second point. The third point I want.
Please speak.
Okay. The third point I wanted to bring is what about millions of population who may not have the immediate medical care that in India? That because I was thinking that how that this maybe there's community care centers, making it more affordable, making it more accessible. How can we do that? Because in the last discussion, when we were talking about senior citizens, one issue that came up again and again, the privatized healthcare. And with the privatized healthcare, many people get kind of in.
Please speak. So please, those who are not speaking, please mute their mic. Disturbing. Okay, madam.
Thank you so much. So no, it's okay, because so many people feel very deprived. So, and there is a kind of, how, like, with the privatized healthcare, maybe Professor Mishra leads the leading medical institution that I grew up in Cuttack. For me, SCB Medical Place is the go-to place, now the university. So, but I have seen the condition, the outdoor patients, people lying on the floors, thousands and thousands, and people even dread to go to the SCB Medical, even though the best doctors are there. So, and everybody cannot afford the privatized medical care. So what do we do about that? because of course we learn the medical conditions, the medical symptoms, the medical also kind of the prevention, the medical care, but what about the accessibility? What about the kind of the availability? That's something to think about. That's my fourth point. And fifth point, I would like to say that there should be even among the educated, what like Barada Babu and the Thinkers Club is doing, to make it more grassroots, to make it more, so that way in the villages, in the kind of in small cities, not just being confined to Cuttack and Bhubaneswar, that how can we spread the information, and so that way the great professors like Professor Mishra can be accessible to all. Thank you so much.
Okay, thank you, madam. Before asking to Professor Mishra, now let us listen from our guest, Dr. Prasanna Das. He's also a MBBS doctor. He can also better.
Hello.
Please.
Hello, am I audible, sir? Am I audible?
Yeah, you are audible now. Please speak.
Okay, thank you very much. Welcome to all you all. Good evening. Really, I am a very pretty senior general physician. So from my experience, I can tell 4 to 5 things. I used to tell my patients as relations that remember 4 to 5 things. First is your diet. Diet must be as per your requirement. May not be less, may not be more. Then second thing is exercise. You must have exercise every day, whatever it may be. Then third thing is that you must have a regular checkup, which you do not do usually. And fourth thing is that your mind should be very much free. You should not worry about everything, because ups and downs, everything there in your life. If you are free and you have some devoted to something, it can down. And regarding the data, people say, I am seen persons, I am not alcoholic, I don't smoke, why you have heart attack? Because there are so many things the people do not know and they apprehend. And naturally, if we propagate all these things amongst our senior citizens as well as other persons, it will improve. So I feel counseling is more better than all these things. However, so far the facilities are available. Definitely, we know about our state of affairs, the condition in the state of Odisha. At least we can afford everywhere the cardiac treatment, care, everything. But we can make propaganda or awareness regarding prevention. However, nowadays we are also taking all care. Even if in our society, in our associations, we are having also different type discussions. Or the government also have planning for that, to have a discussion in the district level, sub-district level, and have awareness among the persons. Thank you very much for giving this opportunity.
Thank you, Dr. P.K. Das. You have taken the leadership of the senior citizen. You might have aware of these problems of the senior citizens. Now, do you feel that this Professor Mishra, what he told, the senior citizens are benefited out of this?
No, it is okay. Most of them know it, but whatever they don't practice. Even I have seen friends telling her, why don't you have regular checkup at least once in a year?
I see.
Or twice in a year, they do not. Somebody tell, no, I will manage like that. And then, of course, for poor people, poverty is another thing. Poverty is another factor. Because in the government hospital, as you know, we can't afford so many things, because the Professor Mr. knows it very well. I also in SCB, I know. Because it is so much overcrowded, it is very difficult to tackle all the patients. So naturally, it should be decentralized, and in the district level, sub-district level, at least the awareness or preventable things should be available.
Thank you, sir. Now, if anybody have a question, the Professor Mishra is there. Already time is there. If you can ask any question, if anybody have, you can ask by introduce yourself. Then Vivek Patnaik, if is there, he will give his views, unless we will go to the vote of thanks. Now, anybody can ask any questions? No questions. It is clearly understood that Mr. Professor.
Sorry, sir. I have one question.
Please introduce yourself.
Yes, I am Suresh Chandra Kaur from Senior Citizen Forum, VSS Nagar. I am General Secretary here.
Sir.
So my question is whether salt has any effect on the heart attack or on the heart?
Professor Mishra, please.
Yes, increased salt intake contributes a lot for those who are hypertensive, and those who have heart dysfunction or heart failure following heart attack or other related conditions. For them, taking extra salt is also dangerous. Not only it accumulates, it also accumulates with it a lot of fluids which the body cannot handle. So even it has been found that for we Asians, that as Madam was telling, South Asians are more prone for heart attack and blood pressure, diabetes, all these things. Maybe genetically we are endowed with that. We should be careful in handling our salt intake. Even somebody who is not hypertensive should also limit salt intake. Unless the environment is too sweaty, needs extra salt. A normal person also should not take extra salt. Forget somebody who has a heart attack or hypertension or blood pressure or diabetes. So extra salt is dangerous. And for that, processed food, tin foods are also dangerous because they contain extra salt.
Okay, sir. Okay, sir. Any next question? Anybody?
Myself, Prasad Guru. Hello, sir.
Please tell again.
Myself, Mohan Prasad Guru.
Okay.
I was a retired general manager NTPC Limited, now settled in Sambalpur. So actually, what medication we should keep for emergency with us?
Right.
That is my question.
Professor Mishra, please.
See, if the person concerned already has preconditions like diabetes and blood pressure, those persons should be more careful. And the contacting the medical person is very important, because do not take the wrong medicine, but at least if there is no contraindication, you can take aspirin. And if somebody is already has a heart condition like heart attack previously or less blood supply to the heart earlier, he knows his medications, can take this nitrates and other things which reduce the ischemic symptoms. Unless somebody is very sure, not venture into that, rather contact the medical person immediately.
Okay, sir. Any question?
Actually, I am having BP and this cholesterol. So I need, and I have not any heart attack problem. So what type of medicine I should keep?
No, in that case, you should have a regular checkup. One can know if you are prone for these conditions or not. So by that, you can take preventive measures, the certain medication. If you are diabetic, you have to take statins. The cholesterol lowering medicines are mandatory for you. If somebody who is more than 40 years of age and diabetes, it is mandatory for him. And those are also have got preventive value. And if there are any suspicion symptoms, you might be also taking the blood thinners. Because diabetes and hypertension, so you are already taking those things. So besides that, if you want to take any of the medication, then I think you should have a proper checkup before that and take the advice of your concerned physician or cardiologist.
Thank you, sir. Thank you.
Any other questions?
Good evening,
I
sir.
think Purnima Mitra wants to ask a question.
Please. Purnima Mitra,
good evening,
you are from which
I
place?
think you have to unmute her.
Oh, no, he has to be unmuted. We are able to listen. Please, Purnima Mitra speaks. We are able to listen it. Purnima Mitra, you can ask. Then next, anybody next you can ask. Then he will later on he will ask.
Good evening, sir. This is Pratap Raut. Just to I have a low diabetic. It is under control, but there is no symptom or any kind of like that cardiac all these things. But we are not like a regular health checkup we are doing. So what prevention or precautions to be taken for all these things? Even if we have an annual health check, hardly we go for that. So can you tell that what kind of precaution or prevention is to be taken for a diabetic failure?
if you are diabetes, you are not going for health checkup. It's I think it's not not a responsible comment.
No, very honestly, I'm telling that go for annual health checkup, but intermittently, whenever we feel that something odd, just okay, we go and have a check. Unless until we feel something uneasiness.
Another thing is important. Sometimes the diabetics, the symptoms are not very typical. They may not always appreciate the symptoms of heart attack because sometimes the pain sensation is blunted in them. So if somebody is diabetic, must take the medication regularly, must control it. And statins are sometimes prescribed. Sometimes they have to take blood thinners if they've got other comorbidities. And certain tests like treadmill test, and if one is capable of, or if there is any suspicion, non-invasive state like CT angiogram are sometimes prescribed. But the basic point is you have to take the advice of your treating cardiologist or physician. There is no shortcut for that.
Okay, sir. Okay, sir. The Bibhu can unmute Purnima Mitra. He's asking for unmute. Can you make her unmute? Purnima Mitra, are you able to listen us? Any questions? Any other questions, or you will go for vote of thanks? Okay, Professor Mishra has spent a lot of times. Now I will request Srimati Manorama Choudhury. Now she is from Boston, USA. She is a very good poet and a writer. Now we have requested, he is one of the active member of Thinkers Club. Now I will request Mrs. Manorama Choudhury to give vote of thanks.
Namaskar. As he said, thank you for your generous introduction, Barada sir. Thanks to Thinkers Club and all the participants today. It's delighted to see all the seniors coming forward to discuss some challenging issues. I thank all our speakers, especially our main speaker, Dr. Shrihari Shridhaye Secy Mr. Sir, for giving us such beautifully presenting the various aspects of heart attack. I loved how you explained the electoral and plumbing problem in a layman term for anybody who is not a doctor to understand that. That was very interesting and very nice. And it's in a digital era, we all have information at our fingertips. We preach, but we do not practice. So thank you, and thank you for stressing, emphasizing again and again on certain aspects, which are like, a good habit of food, diet, like exercise, and all those things are important. We don't do throughout our life. Only when we come to a certain age, we start thinking, oh, we have a problem, let's take care of it. No, you have to do throughout your life. That's a lifestyle thing. So thank you very much. Dr. P.K. Das sir also in a very short summarized your presentation. So thanks to him also. As Annapurna Pandey and Anisi pointed out, I also see many cases here in Boston. Like I have friends who are not even 50 and they go through cardiac attack. Both cases we have seen cardiac arrest and the heart attack. So I do not know if the genetic, because these people are highly active and they do exercise. Food also, I would say very, very much they're aware, but could be a genetic reason, I do not know. And before joining this event, I was also looking at the data for India itself. Cases for 30s and 40s age group has increased just in 2023 for 28%. And that's an alarming number. I'm sure the stress factor contributes a lot. So anyway, thank you very much for inviting me for this educational session. It was definitely I'm thankful for that. Thank you.
Thank you, madam. I will request everybody to share videos in all your relation friends so that it will be informed. It will be a selfless service to the public. So I'll request you can share your video in your relatives so that it will be very much inspiring. So thanks everybody. Now we'll meet our next time.
Thank you, sir. Thank you, sir.
Thank you, sir.
Thank you.
में जो फ्लैट तुम वहाँ पे गए नहीं हो, वहाँ पे हमारा एक फ्लैट है। उस फ्लैट में कुछ नहीं है, वो दीवार पे कुछ सामान है, तो उसको थोड़ा खोद के निकालना है। उसके बाद उसको फिर प्लास्टर कर देना है। हाँ हाँ, निकालना है, उसके बाद फिर प्लास्टर कर देना है। कौन सा टाइम पे? फर्स्ट हाफ में नहीं हो पाएगा। अरे नहीं, तुम किसी को ही बोल दो, उसको पिक करना है, क्या करना है मैं करवा लूंगा। हाँ बताओ थोड़ा मेरे को।